I would like to call upon Dr. Swarna Dissanayake. She is the consultant dermatologist at Teaching Hospital Kandy, and she is going to talk to us about cosmeceuticals and anti-aging, what we really know about cosmeceuticals. Over to you, Swarna.
Thank you very much for the kind words of introduction, dear madam. Good morning, everybody. Again, I would like to thank college for giving this opportunity to talk in this topic. I think everybody will agree with me that there are more people seeking advice regarding to look younger, perhaps to reverse the signs of aging. Although we have very successful methods like fillers and so on, the people prefer to have rather non-invasive and cost-effective methods to upgrade their appearance. So the cosmeceuticals remain an attractive option as they are freely available and as well as affordable. So we all are being dermatologists. It is better to ask ourselves what we really know about cosmeceuticals, especially cosmeceuticals in anti-aging. In this talk, I'll be going through what is cosmeceuticals and the legal aspect, dermatologist role regarding cosmeceuticals, and the rationale behind anti-aging cosmeceuticals and main anti-aging cosmeceutical ingredients, and back with their scientific evidence. What is cosmeceuticals? They are cosmetic products which provide effect beyond cosmetic enhancement. They are defined as cosmetic product or skincare products with biologically active ingredients and purporting to have a medicine or a drug-like property. It is a marriage between pharmaceuticals as well as cosmetic. And cosmetics are meant to cover or beautify the skin, just sit on the skin, whereas cosmeceuticals designed to serve a dual purpose, the aesthetic effect as well as therapeutic benefits. So it crosses the skin barrier to exert their effect. The cosmeceuticals have the properties of pharmaceuticals as well as cosmetics. So we'll see what are the similarities and differences among these three groups. As we all know, cosmetics are very common and very freely available as over-the-counter products. It does not change the biological function of the skin. If at all, it hydrates, moisturizes, or nourishes the skin without changing the skin function. We have a range of products from budget brands to luxury prices. As we all know, the drugs are very effective and very potent and target specific, penetrate through layers of the skin to exert their biological effect, and available only through prescription from pharmacies. The cosmeceuticals, people considered them as medically graded cosmetics or dermacosmetics. Like drugs, it contains at least one active ingredient. The active ingredient may be similar to that of a drug, but it is in lower concentration. Also, it has a biological effect and gives noticeable clinical results. Can be available as over-the-counter product as well as from prescriptions from dermatologists as well as plastic surgeons. The father of the cosmeceuticals is Dr. Klintman. He popularized this word to introduce a range of products which had properties of cosmetics as well as pharmaceuticals. Let's see how cosmeceuticals come to the market from its raw material. First step would be selection of active ingredient, the source of active ingredient, and extraction. Then confirm that active ingredient have a pharmacological, the cosmeceutical action. Also, it is subjected to in vitro testing to assess the safety and efficacy. Then the active ingredient is placed in a suitable vehicle, and sometimes it is subjected to test in clinical test in animal or human. In contrast to drugs in this point, there is no requirement to prove efficacy of the cosmeceuticals before it released to the market, because it depends on the claims made by manufacturer. As far as chemical formulation concerned, basically there are broad two groups, and biologically active ingredient or a functional component or a structural component is the vehicle. That is also important to maintain stability, penetration, and control release. In addition, the chemical stability and shelf life also affect overall efficacy. The nanotechnology in cosmeceuticals. It is rather new trend in cosmeceutical delivery system. It has been used massively in the field of dermatology, the cosmeceutical industry. It is something about particular size which are in nano sizes. We have different nanoparticles like liposome, neosome, and they have targets the specific site of delivery. For example, nanostructured lipid carriers deliver the active ingredient to the sebaceous glands. These are active bioactive molecules and compatible, they have biocompatible matrices to which active ingredient is absorbed or encapsulated or covalently bound to deliver the site of action. What makes nanoparticles so unique? Not only downsizing, as we know, downsizing increase the surface area and increase the binding capacity of an active ingredient, but also it has a quantum effect and subsequently aesthetically pleasing effect. And what are the benefits? The nanoparticle engulf the active ingredients, so physical stability is maintained because of the occlusive properties, and target-specific delivery will take place, and it has a property of controlled release. So overall efficacy can be achieved. Therefore, the nanoparticles improve bioavailability of active ingredients at minimal doses. Also, it facilitates the skin barrier crossing. The legal aspect of cosmeceuticals. The term cosmeceuticals has no meaning under the law, so it is not subjected to recognized by Food, Drug and Cosmetic Act, because there is no such category called cosmeceuticals. However, we know the drugs and cosmetics, according to FD&C Act, we have legal definitions. But cosmeceuticals do not have a legal definition, and it is highly unregulated or regulated by manufacturing company. The legal framework significantly differ among different countries and different markets. So we don't have international consensus in regard to drugs, and it is far from being harmonized. And some are tested for safety. However, the testing of viability of an active ingredient in the product is not mandatory, and the legal and regulatory background at the moment is a puzzle, and currently cosmeceuticals are segregated under the subclass within domain of cosmetics or drugs. In Europe, it is considered as a drug. In USA, it is under the cosmetics. Also, the cosmeceuticals considered as borderline product. Cosmeceuticals are released to the market along with the claims made by manufacturer, in contrast to drugs. So, as it has an active ingredient, the best way to evaluate their efficacy is properly conducted clinical trials going through these steps. As this is not formally recognized by any regulatory body, no grants to conduct the the research. So we have limited research in academic dermatology. These are mainly done industrial based, and these are less comprehensive and inconclusive. What is the role of dermatology regarding cosmeceuticals? We have challenges and rewards. The challenges like the no regulatory bodies or legal definition and safety and efficacy is extremely questionable. Meantime, it is the fastest growing segment in a skincare product, and it has taken over the market, personal care market across the globe. Meantime, there are easy accesses for this product as well as product information. For example, social media as well as from colleagues. So people have lots of concern regarding these cosmeceuticals. Meantime, we have rewards like it has a definite pharmacological action with low risk profile and sometimes give significant effect. It is not an exaggeration that the 30 to 40% of any dermatologist prescription usually consists of cosmeceuticals. And people think that a dermatologist is the source of number one recommendation for product information. Also, they expect that dermatologist has pre-screened the product and the better product has been chosen for them, like drugs. However, it is not most reliable with this product because we don't have very good scientific data regarding this product. However, it is our responsibility to give solid and scientific information when people have concerns regarding these products. So we need to adapt a method to evaluate the potential therapeutic merits of these products scientifically. So first of all, we need to familiarize with these products, the popular products, and we have to ask ourselves 3 questions. Can active ingredient penetrate the skin barrier and be delivered in sufficient concentration? And whether it has an active ingredient have the demonstrable effect on human skin. And third one is, are there well-powered clinical study to substantiate the claims? So answering to these 3 questions, we can give fair, reasonable answers to the concerns of the patients. As far as classification concerned, there are no definite classifications to the cosmeceuticals, and here it is classified according to the skin sites they are used. Among them, skin cosmeceuticals are dominating in market share revenue. It is more than 50%. And skin cosmeceuticals have a rise in global trend. You can appreciate from this bar chart comparing 2015 and 2020. And among them, anti-aging cosmeceuticals are the frontier in global market, followed by whitening agents, which have huge popularity in Asian countries. Let's move on to most popular cosmeceuticals or anti-aging cosmeceuticals. First, we recollect our memories regarding aging. As we all know, it is a biological process affected by genetic and environmental factors. There are a cascade of biochemical reactions which lead to formation of harmful substances as well as harm to the organelle in the cells. However, these pathways share some common biological harmful products like reactive oxygen species formation, inflammation, which lead to aging of epidermis by affecting barrier function, as well as the pigmentary properties and the hydration. Also, it affects fibroblast and cause aging of the dermis. And what are the main culprits of damage? The sun or radiation exposure, free radicals, the inflammation from these pathways, and direct or indirect DNA damage, as well as mitochondrial damage in these cells. The aging causes decrease in function in keratinocytes and fibroblasts. these two cells get lazy and become less responsive to cellular signals. Meantime, melanocytes have a chaotic, unpredictable behavior. Why do you look older when you age? With the reduction in substance in dermis like collagen and so on, along with damage to same substance and DNA, mitochondria, and extracellular matrix junk. These pictures compare the aging features, younger phase and the aging phase. You can appreciate the features, and the other picture shows the microscopic differences. You can see quantitative as well as qualitative defect are mainly markedly seen in these epidermis as well as dermis. What are the properties of an anti-aging cosmeceuticals? These cosmeceuticals should have properties to stimulate fibroblast keratinocytes, also to keep the melanocytes under control. Those can be, then epidermal strengthening can be achieved with the extracellular matrix regeneration, and with antioxidant property should be there, and sun protecting property as well as pigment regulation property. What are the common ingredients in available anti-aging cosmeceuticals? There are three broad groups divided according to the function they have. The first one is induction of tissue repair. It's mainly done by retinoids and UV1-like growth factors. The second group is scavenger of reactive oxygen species, mainly done by antioxidants. The other group is immunomodulator or immune response modulator or anti-inflammatory agents like niacinamide. There are also the skin lightening agents, sunscreen and moisturizers are common in anti-aging cosmeceuticals. These are available as cleansers, lotions, and cream and gel. The marketed properties of this some ingredient have been tested thoroughly and supported by very good studies. However, all these ingredients have not been tested up to that standard. Some have been only in vitro clinical trials, and there are hardly any human clinical studies to prove their efficacy. Let's go through some studies. Start with retinoids. Synthetic ones are the main components of retinoids. It inhibit collagenase and matrix metalloprotease in the cells, so improve collagen synthesis hyaluronic acid. So the dermal component and dermal, the elastin collagen is improved, the synthesis is improved, and the active ingredient is retinoic acid. This substance should converted into retinoic acids to give a very good effect. We have wonderful data, the very good studies, randomized, controlled, double-blind, comparable studies over again and again over years, past 20 years, to prove their efficacy. According to this data, we have strong clinical evidence. This two column shows the black colored one what we have in the cosmeceuticals, and the minimum concentration there should be in these cosmeceuticals to have a significant effect. The blue colored ones are mainly in prescription medications. There are combinations also available, for example, like vitamin C combined with vitamin C and glycolic acid, which have the moderate to low evidence, clinical evidence regarding their efficacy. The hydroxy acid, glycolic acid, and salicylic acid are the mainly in cosmeceuticals, and it has property of control, chemical exfoliate, as well as stimulate the fibroblast. Among these, the alpha hydroxy acid, glycolic acid have a very good clinical studies regarding their the clinical efficacy of the anti-aging as well as anti-acne property, it should be at least 10% in concentration. However, beta-hydroxy acids do not have a very good data, clinical evidence, as it is available in 2% in concentration in the market. We have the overflowing baskets of antioxidants to mop up reactive oxygen species. It blocks the main culprits, all the culprits which causing damage the skin, and among them vitamin E is it's the one most studied substance as an antioxidant. Tyrosinase inhibitor also helps in collagen synthesis. It has a drawback as it is what soluble absorption is a problem. Stability also, it is highly unstable when it is exposed to air. We have wonderful data regarding its anti-aging and lightening property. The very good the studies, double-blind randomized control trials. And according to this data, the strong evidence supporting their anti-aging property, and however derivatives of this substance is not evaluated, and as it is unstable, ascorbic, the studies available for L-ascorbic acid cannot be generalized to all vitamin C containing product. Based on this review, it should be at least 3 to 10% in concentration and should, to stabilize it should be in opaque and airtight bottle. And also we have from antioxidants, we have moderate level of evidence regarding carnitine and ferulic acid. Also, they have additive effect when they are combined with niacinamide, as well as the ferulic acid when it is combined with vitamin C or vitamin A. Other botanicals, it comprises a largest category of the cosmeceutical additive, like camellia, like rose extract, so on, and we have low level of evidence, and their use is highly unregulated and often unsupported by the science. And vitamin C also very popular, and we have low level of evidence. Again, coenzyme Q, lipoic acid also very common, and those are those have very low level of evidence regarding the anti-aging property.
You have 2.5 minutes.
And niacinamide also have a moderate amount of evidence regarding their anti-aging effect. And lightening agents, what I have highlighted have lightening effects, and they are mainly in the cosmeceuticals. And although we have long list of the lightening agents, we have high level of evidence in 5% tranexamic acids, kojic acid and ascorbic acid, moderate amount of evidence in 4% niacinamide. Also sunscreen available as combination or the alone in cosmeceuticals, and the SPF value is not evaluates complete anti-aging photoprotective property, and tinted sunscreen is a newer one which block visible light too, and we have moderate amount of data. Moisturizer also we don't have very good data regarding their efficacy. Innovative ones like growth factors, bioactive peptide, those have a very low level of evidence, though it improves signal capacity of the response to the signals by cells. This slide summarizes what I have told you so far, and most of the agents you can appreciate that have low level of evidence. So I would like to conclude that cosmeceuticals are the future generation of skincare, and which offer both challenges and rewards to the patient as well as physicians. Cosmeceuticals make therapeutic claims without, while avoiding the regulatory framework of pharmaceuticals, and often brought to the market without robust clinical testing. as technology advances, cosmeceuticals become sophisticated and widely used, and medical profession must continue to take an active role in familiarizing with these products. And uh, cosmeceutical industry is an evolving field. Most of the cosmeceuticals need scientific evidence, as many of the marketing claims for the ingredients are based on in vitro clinical studies that cannot be generalized to the clinical effect. Thus, ongoing high-quality clinical research is dire need to evaluate their efficacy and with legal ordinance and harmonized regulatory background. Thank you for kind attention.
Thank you very much, Swarna. That was an excellent presentation. You put it down very clearly, a very muddy and great topic. I'm sure the audience has many questions for you.
Thank you so much, Swarna, for that very informative lecture. This is just one clarification. Now, regarding the legal framework of cosmeceuticals. In Sri Lanka, we have this category called borderline products. So most of the cosmeceuticals fall into this category. But again, in the cosmetics category also, there's going to be another subcategory called prescribed cosmetics. So there may be some overlap between those two categories like cosmetics and cosmeceuticals. But in the near future, we are going to, the two subcommittees are going to meet and take a decision regarding the border. So after that, maybe we should be able to update everybody what's happening, and also about the level of evidence. At the moment, the NMRA has put up a condition saying, like, if you make a claim, you have to provide evidence for the finished product. The same thing, like you have evidence for in vitro testing, not in vivo.
Wow.
But unfortunately, most of the products that come up for registration, they don't have any evidence for the finished product. So if we go by this, if we have this as a hard and fast rule, probably most of the products that come up for registration will not get their registration. That is where we stand now.
Been not registered from 2015 to 17. From 2017 onwards, we have started registering cosmetics. Anyway, borderline products have been registered right throughout. So we are trying to clear the backlog, but the things which have come up during that period, there are problems. But at the time of registration, as Indira mentioned, even they are cosmetics, according to the international guidelines, they have to provide the evidence. And for the cosmetics, we are checking mainly the safety. But in the case of borderline products, they need to give the evidence for efficacy also.
Clinically.
Although worldwide the trend is that they say the cosmeceuticals and these things do not, we don't check for safety, but in our country, probably in the future, we will be checking everything in a very methodical manner, right?
Any other questions? May I add a comment as well? Now, as dermatologists, sometimes this industry, they bring us products, and then when you look at the ingredients, there are these botanical names which are jaw-breaking names which you can't even pronounce. And then some of them are at sub-therapeutic levels actually, even though the name is mentioned there, really they are not having an active effect. So how do we navigate ourselves in this kind of setup? Can you give us some kind of a plan to deal with how to evaluate these products?
We have to go with the literature and see whether we have clinical evidence, clinical trials, giving the, for example, vitamin C, it should be 3 to 10%, like the percentage, and everything should be considered, the stability, whether it is stable, the vitamins, if we consider vitamin C, if it is usually colorless, if it has turned into yellow, it is not active. So like that, we have to go through individually and look at what are these three questions I put up there. Answers should be there when you are prescribing a cosmeceutical ingredient. You need to thorough with the what ingredients are there and what is their action, whether it is in the proper composition. Everything should matter.
Thank you, Swarna. I think we need to wind up. Thank you once again for that excellent presentation. Please accept your certificate.